kinds of crazy things for relationships.
Welcome back to Talk Living on the Body and Balance channel. We're live from London all this week talking about weight, how to lose it, how to live with it, how to love it. If you have any questions, just text us on 87474.
And you can also visit our website, bodyinbalance.tv, where you'll find a whole host of useful information. But right now we're talking to Dr. Nicole Gehl about eating disorders. Now, a question for you, Nicole. When we talk about cures for eating disorders, are we talking about ongoing management or closing a chapter?
I think for some people, ultimately, it can be closing a chapter, but for most, it is ongoing management. It's a lifelong struggle to battle with food and body image, particularly in the society that we're living in. And, you know, as I had said before, unlike alcohol, unlike drugs, unlike other addictions, you can just abstain. Food is something that our social world are very much developed around, something that you have to deal with 3 times a day, and so it's not so easy. So it's very much about ongoing management.
And there is a combination of therapies, isn't there? I mean, how do you know which therapy is right for that particular person?
An expert like myself will do an assessment. I think cognitive behavioral therapies are the most effective at the moment, is what the research is pointing towards for eating disorder treatment methods.
But also quite often family therapy, no?
Family therapies, systemic therapies, absolutely.
Which in itself can be quite traumatic for the family. So the family may have had to endure watching the person they love apparently killing themselves in the case of anorexia, and then they've got to go in and kind of sort of, I mean, that's a personal thing, isn't it? Very private things have to be discussed in front of a therapist.
Most certainly.
Can you explain a little bit more about the cognitive therapy? What would you typically go through with a
cognitive behavioral therapy, you're looking at what the thought patterns are and how they link in with the feelings and the behaviors. So, for example, if I were to say to a person who's suffering from anorexia or bulimia, just poor body image, you know, you're looking really healthy today. What that thought, what they'll translate from that will be a thought of, I look healthy, I look fat. And then that will lead them back and towards their binging and purging behavior.
Is it similar to when I did a neuro-linguistic programming course, and is that similar because it was all about the thinking process, disassociating things and taking them out of the mindset of associating a disorder with that? I mean, is that similar?
I've done both, and I was CBT and NLP, and I would say that both of them are about saying that your thoughts are affected by your feelings, and your thoughts aren't automatic. So, you know, in NLP they talk about how everything that we think is filtered through our life's experience, and certainly, so I think it's similar. It's challenging your automatic thinking around, but in this case, about food in your body.
In my treatment with people with eating disorders, I'm very much looking at the meaning-making processes, as opposed to just what the thoughts are. I'm looking at what the meanings are.
What about something like body dysmorphia, where somebody who's very slim still thinks they're overweight? How do you get over that?
That's actually the biggest challenge in regards to engaging clients with that sort of a problem, is them acknowledging that that is something that they're struggling with, that this isn't the reality. What they see in the mirror is not what everybody else sees. The consensus reality is something different.
Now, you go to a lot of conventions. I mean, what are some of the theories of therapies that are talked amongst your peers? What are the most effective, do you think?
Well, in addition to cognitive behavioral and systemic therapies, there's existential therapies, there's psychodynamic therapies, which can be very, very helpful.
Wow. Okay. What about what a family can do? For, you know, obviously, you know, they might need professional help, but a lot of parents will just want to say to their teenager, just eat.
I think just
That's not successful.
Is a very, very sort of fruitless exercise to say just eat. The most important thing you can do is look at yourself, look at your own attitudes towards food, the attitudes you have towards the body. Look at how the person that you love, that you care about, how they're coping with lives, and what other coping mechanisms you can perhaps teach them, and model more effective coping behaviors as well. Encourage them to talk, you know, to a friend, to a family, hopefully to a professional as well, but, you know, little steps where they're most comfortable.
And take the focus off the way they look so much.
Take the focus off the way they look. Take the focus and put it much more on who they are and what they want their lives to represent, what their values are.
It's been a real pleasure talking to you. Thank you very much for coming on the show today. If you've got any people in your family with this kind of issue, go and have a look at the website, all the W's, bodyandbalance.tv. There'll be some information there.
Great. And tomorrow we'll be looking at weight loss and the association with your skin. But that's it for this evening, and we're going to be back tomorrow at 1:30. So from Stephen Hattyside
and Larry Turner.
Good
See
night.
you then.